Hey guys, Dr. Nicholas here from WujiMedicine.com, and today I would like to speak about frozen shoulder. Now lately I've been getting lots of this condition coming in the clinic. We would have had about 20 different patients coming in over the last 3 months with frozen shoulder. So I thought I'd do a video for all of my patients that are suffering from this chronic condition. So basically what it is a few different things that involve, but basically it's trauma that's happened to the capsule in the shoulder. And usually the two tendons that attach to that area come from the infraspinatus, which is a posterior muscle. In Chinese medicine, we relate that to the han tai yang, or small intestine channel, and then we have the anterior attachment that hooks under here, that's coming from the subscapular, which is coming from the han yang ning, which is the large intestine channel. And generally what has happened is a couple of things. One, it could be an impact trauma as falling and causing that injury to that area, and it's not healing properly. Or second one, it's like work related, kind of repetitive stress, could be going to the gym and could be overworking that muscle. So basically what ends up happening is that the area gets injured. Because it's a little bit deeper, it doesn't quite heal fast enough, and so it starts to cause a little bit of thickening of the tissue, the connective tissue around there, starts to cause some little bit of adhesion, so forth, and this basically really starts to lock up the joint and lock up all the tissues deep within the shoulder cavity. And so in Chinese medicine, we relate this to blood stasis, obviously, because the blood's not getting into the joint and providing the joint with enough lubrication and anti-inflammatories and so forth into the area. Usually with frozen shoulder treatments, it depends on a few things. One, if it's an acute injury. Two, if it's been for a while, or like if it's been in a chronic situation, or somewhere between that. And often what I find with treating frozen shoulder depends on how long that person's had it, and to the degree of the injury that's in there will determine on how much I treat that patient. It is a very hard condition to treat. I use a combination with this one with distal points across the hands and the feet, along with using local twin mobility exercises and qigong for rehabilitation. But what we're trying to do is increase the blood flow and the qi oxygen into the both the han tai yang and the han yang ning in areas that correspond to this region. And what I usually found with this condition is that every time a patient comes, it gets about 10 degrees more, 10 degrees, 20 degrees. Now, if we do 12 sessions, that usually relates in the patient getting the arm up to here. It is a slow healer. If it is just something that's just a little bit of pain, if the patient can already bring the hand up here, then to get it from here is not going to be as a big issue as compared to having it lower. Other treatment options often include a little bit of surgery, depends on how damaged the actual area is, or a bit of physiotherapy. And although I feel that manual therapies are really useful in this situation, if the brain is signaling that there's pain in an area, every time you do an exercise that causes pain, you're actually worsening the condition, because the brain's now getting signals that that area is more hurt. So the reason why we use distal method acupuncture is to work as a distal analgesic to the brain, which can lower the pain down here, which can allow opening through the joint and allow that range of motion to allow as much blood flow into that area. Pulse-wise, there is a few things that we can work with herbs. I'll share that in another video. But pulse-wise is really important. An acute situation usually is a lot of inflammation, and that inflammation is that the body and the immune system is trying to increase vasodilate blood flow to that area. So usually in this position, we're in the right chair position, and we feel into the pulse there. It's normally very strong. And if there's blood stasis, we won't feel the shape of the artery. It would rather just like a blood kind of feeling over that area. So it's we get that, and if we might get a patient who's very small and thin or weak, you might find that the pulse is there, but it's a very weak and wiry. Wiry usually indicates that there's some form of neurology involved. In Chinese, we relate that to wind. So what the focus is, I always say to patients, look, give it a moment with this one. It's best to do 2 treatments per week for about a month and then drop off. Once the pain's 50% or the improvement is by 50%, that's when we start to go once a week. Once it's down by 25% from there, so 75% overall, we can start to push it out. But it has to have manual therapies. We have to look at nutritional supplements, we have to look at herbal medicines, and we have to look at doing some form of qigong integrative active therapy like qigong or physiotherapy. I've had great results with it. It's a frustrating injury. I mean, the name itself, the adhesive capsulitis, often known as frozen shoulder, is a very, very difficult, slow healer. It doesn't happen overnight. And a really kind of interesting thing that I found about adhesive capsulitis, it always has some relationship to the body's ability to process and to digest and metabolize sugar. So a lot of the time these sugars will get into the blood and just damage the micro capillaries in this region, making it difficult for blood flow to get in. So I do like to look at diet as well. Anyway, to all my patients that are currently going through training and rehabilitation for frozen shoulder, just know that I'm doing everything we can to get as much information. It is a slow healer. Your body will heal with the right treatments, and just keep doing as much movement without pain as possible. Thanks everyone.